All right, this will be the lecture on cranial nerves. This goes with the skull lecture. We're going to be looking specifically at the cranial nerves. There are 12 pair of cranial nerves. We number them 1 through 12 using Roman numerals. And this is the one place that in class we have to use the Roman numerals. And for each nerve, you have to know the number, the name, the foramen of exit, the modality or modalities, and the function. Now, I'm going to go through, and each of these slides is going to have that information that you need. And I recommend making 3x5 cards based on these slides. So the first thing we need to do is know the numbers and the names. And the best way to do that is to come up with a mnemonic, which means a memory device for remembering that. And the one I've written out here is O, to touch and feel very good velvet. Which goes for olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, and hypoglossal. This is not the only mnemonic out there. When I was about 10, my dad taught me on old Olympus towering top, a Finn and a German viewed a hop. There are several out there. One involves Harry Potter, Voldemort and Horcruxes. There's several other themes out there. Find the one that works best for you. You're welcome to use this one, but if this one doesn't work for you, just Google cranial nerve memory, and you will get half a dozen different ways to do this memory device. So find the one that works for you. You will get a sheet of scratch paper for the exam. And when we do that, I will give you 2 minutes at the beginning of the exam just to write down your mnemonics from this section, and then you can refer to it. You can't bring it in pre-done on a card or a piece of paper, but you can create it once you're in class to show me that you know that information. So let's start with cranial nerve number 1. So this always works anterior to posterior, where we start the most anterior is 1, the most posterior is 12. So you would never find, say, 7 coming before 5, for instance. So you're always thinking in terms of 1 through 12 work anterior to posterior. The first one is the olfactory nerve. It comes from the olfactory foramina. That one's nice because it's named for each other. It is cranial nerve 1. It is SSA for smell. And you may remember that olfaction is the sense of smell. So that's a nice even one. This piece right here has all the information you need. We have the number 1, the name, olfactory nerve, the foramen of exit being the olfactory foramina, the modality is SSA, and the function is smell. So that's how I'm going to do each of these nerves. The second one is also in this drawing. It's the next one moving anterior to posterior, the optic canals. Now, the optic canals are for cranial nerve number 2, the optic nerve. Isn't that nice? We get the nerve and the canal named for each other. It is also SSA for vision because optics is visual. The third one is a little bit more complicated. I took this picture using the skull because in the previous picture, we cannot see the superior orbital fissure. None of the artwork has it. It is on page 178 in your lab book, or no, 177. The picture drawing on page 177 has all the foramina with all their cranial nerves. Do not memorize the brainstem on 178 with the cranial nerves. Use 177 instead. So we have 4 nerves coming through the superior orbital fissure. And so if we think about our mnemonic, this was O because 1 and 2 are OO. This is to touch and in my mnemonic. And O stands for oculomotor. Oculo means eye, motor means movement. So we're going to move the eye. It does both SE, the voluntary movement of the eye. So you want to look up, you want to look down or to the side. And it is VE, which is the involuntary movement of the lens of the eye and the pupil. So this is where you go from a bright room into a dark room, your pupil changes size, or this is where you're looking at one thing that's very close and then you look up the wall someplace else and you have to change the lens to change your focus point. Cranial nerve 4 is the trochlear nerve. It is also SE to move the eye. It moves one specific muscle. Now, you don't have to learn the names of the specific muscles that are being moved, just that we're moving the eye. And I'm going to skip down now here to 6. The abducens also moves the eye. So what we see is 3, 4, and 6 all are moving the eye. I don't know if that summary will help or not. And then 5. 5 is the trigeminal nerve, and tri means 3, and Gemini means face. So we have 3 parts to the face. I'm going to draw these lines on this skull. We have the superior 1/3. We have this middle 1/3, and then we have the inferior 1/3, right? So trigeminal. So we have part 1 goes to, it should be superior. I stopped doing the words. So superior 1/3, middle 1/3, inferior 1/3. Part 1 goes to the superior third. We'll see the rest of it in a moment. That is called the ophthalmic branch of the trigeminal nerve, meaning of the eye and the face. So it's going to this piece. And the key here to remembering this one is touch. It is to touch. And remember that touch is an SA sense. It's a general sense. Therefore, this is SA to that superior 1/3 of the face. And then I came to the inside of the skull and I said, okay, I reminded you that the superior orbital fissure would be deep to this piece of the wing of the sphenoid, and that it is cranial nerve number 5, part 1, the ophthalmic branch of the trigeminal. And I put it on here so we could look at the whole trigeminal, which splits into 3 pieces, hence tri. And so it has 3 foramen. We have the foramen rotundum, which means the round hole. It gets cranial nerve 5, part 2, the maxillary branch. And what happens with rotundum is this is a hole through the sphenoid bone that then goes into the maxilla, through the maxilla, to come out onto the face in that infraorbital foramen that's on the face, that facial landmark. And it's still part of the trigeminal, which is still touched. So we still have SA to the middle third of the face and the upper teeth. So that's going to go to that middle third. And then finally, we have the foramen ovale for the mandibular branch of the trigeminal. So it's 5 part 1, 5 part 2, 5 part 3. And if you think of your face starting at the top, we have 1, 2, 3 parts. Those are the 3 parts of the trigeminal. We still have SA, lower third of the face, the inferior third of the face, and the lower teeth. And it also includes the anterior 2/3 of the tongue. One of the things to remember about ever getting your teeth fixed, like your filling on the lower, is if they numb it to work on your teeth, that means your tongue is also numb and you can bite it without feeling it. But we also get this SE for the muscles of mastication because it's going to the mandible. The mandible is how we chew. Now, we're not going to do all of the muscles of the head. We're going to have 2 really large groups. We're going to have the muscles of mastication, which are all about chewing and moving the mandible. Masticate is to chew. So this is that SE, which is why this opening is slightly larger because it has 2 modalities.